Good morning, everyone. Again, it's my privilege to be here today. I think this is a really great concept to educate the community about prostate cancer. I've done a lot of talks in the community, and one of the frustrations that I've had is to try to reach as many men as possible about this topic, especially African American men. In my practice, I'm a family physician, and prior to starting my practice, I was in academics for about 5 years, but the number one cancer that I've seen affect African American men is prostate cancer. I've screened a 40-year-old that had prostate cancer, and it is a very, very common problem in our community. So I want to talk about cancer prevention. The slides were great because it mentioned about the fact that we don't really know exactly how to prevent it, but there is some data to suggest some lifestyle changes that we can make to reduce our risk. And so that's what I want to focus on. I'm going to present a couple of studies that talk about that. Okay, so I just want to talk about some basic cancer prevention information. So we know cancer is the second most common cause of death in the United States. And the slide on here, the bullet I want you to really focus on is that current research suggests that up to 50% of all cancers are preventable. So think about that. I mean, think about family members you may have had and that develop cancer, and usually it's in the end stages when they develop it. A lot of us think that when you get cancer that there's really not much that you can do. But the fact of the matter is there's a lot of things that you can do in your lifestyle to reduce your overall risk from a variety of cancers. And the key is lifestyle changes. So how does cancer develop? Now, I'm not going to go through a very long biology lesson, but I just wanted to give you guys an overview of the general principles of cancer development and why prevention is so important. It's a little bit hard to see because I think the area where you guys are looking at me is blocking it, but the bottom line is this. There are a variety of what's called carcinogens in the environment, all right? So when you think about skin cancer, right? So a major carcinogen is UV radiation exposure, right? And so over time, if you're exposed to UV radiation, then it damages the DNA. And as you go up my slide here, then you can develop a cancer cell, let's say something like a melanoma or squamous cell cancer, and then it will develop into a tumor, and then eventually you have cancer. And somewhere in that process, a diagnosis is made. So let's say you have an abnormal finding on your skin, you go to your doctor, they do a biopsy, and they diagnose the cancer. The fact of the matter is the development of that cancer started probably many years prior with damage to the DNA. So the concept is in general the same for colon cancer or prostate cancer. The theory is that there is some exposure to a carcinogen, right? And over time, the cancer develops. You notice I have here a maze, and the reason I included that in the slide is because this is very, very complicated, and we don't understand all the details of how cancer is activated and how the carcinogens interact with the human body. And so that's why there's a tremendous amount of research looking at that. But the key is there's an exposure, and over time, the cancers develop. The importance of this slide is that if we have a lifestyle that tends towards prevention, there's a possibility that we can slow down that process. Although we don't exactly understand how it occurs, this is what some of the data suggests. Right, so what are your risk factors? So we know that 66% of all cancers are influenced by these four areas here: tobacco use, excess weight, okay, poor diet, and inactivity. So those are the four big ones that we feel account for 66% of all cancers in the United States. And think about that. 66% of all cancers are influenced by those four risk factors. So if we can identify those risk factors and try to modify those, the thought is, even though we can't clearly define it, we at least can reduce risk. So I'm going to talk about some of the more clearly defined risk factors. The first one is prostate cancer risk and alcohol. And so there was a recent study I think it was 2010 that looked at men who drink alcohol, the amounts they drink, and the risk of prostate cancer. And the bottom line was that men who drink alcohol consistently and heavily are at a higher risk, maybe at a higher risk for prostate cancer. And I just wanted to put some of the numbers here so you can get an idea. So men who drank 50 grams of alcohol or more per day were at an increased risk of developing high-grade prostate cancer. And I know you're probably thinking, wow, that's a significant amount of alcohol. But I have two patients of mine that I diagnosed with prostate cancer who they drank pretty heavily, who developed prostate cancer, one in their 40s, the other in their 50s. So 50 grams of alcohol equals 4 beers, you see 4 glasses of wine, or 3.5 drinks of liquor. The research also suggested that men who drank 5 or more days per week were also at risk for developing more aggressive prostate cancer. So not only did these men get the prostate cancer, it tended to be more aggressive. Sorry about that. So the question in your mind may be, well, how much can I drink? And the current recommendations are that you drink no more than 2 drinks per day. And you can see the amounts: 12 ounces of beer, 5 ounces of wine, and 1.5 ounces of 80 proof distilled spirits. So again, it's a moderation message. It doesn't mean that you can't drink alcohol. It just means you have to drink in moderation. As a matter of fact, red wine has a lot of health benefits, as many of you probably know, and it's out in the media as well. So alcohol in itself is not bad. It's just really the amount of consumption. So prostate cancer risk and smoking, all right? So in general, when you think about smoking and prostate cancer risk, what do we all think about, right? What type of cancer do we think about? Lung cancer, of course, which makes sense. But there are a variety of other cancers that are associated with smoking. And again, you can see there's a 40% increased risk, increased chance of developing prostate cancer compared to those men who don't smoke. Okay, so if you take non-smokers compared to smokers, those who smoke over time are at an increased risk of developing prostate cancer. And it appears to be dose related. So again, the longer you smoke and the more packs per day you smoke, the more exposure you have to those carcinogens that I mentioned earlier on, then the risk is increased. And I have a story about that. Even I think it was about a month ago, I diagnosed a gentleman in his early 50s, and his only risk factor, he wasn't overweight, he actually exercised, but he smoked like a train. He smoked 2.5 packs per day for about 20 years, and he developed prostate cancer. Fortunately, we caught it early, and he ended up having his prostate removed, and he's doing well. But again, we had that discussion. And in fact, he told me, he said, well, I figured if I smoked, I get caught by lung cancer, but I never thought about prostate cancer. So again, it is a risk factor. Let's talk a little bit about diet. And this, of all the slides I'm going to show you guys, this is really the most compelling. Because as an African-American male, I've done a lot of research as to why do we tend to develop it at a higher rate than other racial groups. And we don't know all of the answers. I think genetics plays a role. But I looked at this study. Now, this study is what's called a population-based study. And the reason I want to mention that is that it gives you basic information about what some of the risks are so that researchers can go back and maybe study it in detail. And what they did, it was really interesting. They did a dietary study on all the major racial groups, okay? And they looked at their consumption of certain foods and risk. And the study showed that black men who ate more of certain processed red meats, bacon, sausage, hot dogs, look at this number, had a 170% increased chance of developing prostate cancer. I mean, that is amazing, 170% chance. And then when they looked at that same thing in white men and Asian men, there was no increase in risk at all. And so the thought was that cooking techniques may make a difference, and also genetic differences in processing those carcinogens. Recently, some researchers think they found the major gene that causes prostate cancer. And what they found is that on a gene, there's certain sections on the gene that if they get turned on, can lead to prostate cancer. Other racial groups, so whites, Asian, their numbers turned on a certain part of the gene, whereas in African American men, the signals that were turned on in that gene were completely different. So it was almost as if the other racial groups, when that gene was turned on, were in one group, and the African American men were on another group in terms of the expression or turning on those genes. Is everybody following me with that? It's basically when the gene is turned on that starts the problem with the development of cancer development at the gene level. It tends to affect our genes differently than other racial groups. Does that make sense? Okay. So those carcinogens act differently in African American men than other racial groups. Okay, everybody with me on that? Okay, I just want to make sure I was clear. And it had to do with red meat consumption. And so I want to show you guys this next slide here. So they broke down the groups into those who ate a small amount of processed meat and those who were medium and high. And I wanted to show you guys the difference between the low group and the high group, just to show the difference. So those who ate a low amount of processed meat, and I chose bacon because they looked at sausage and hot dogs, but I knew, bacon, we could all relate to eating bacon, right? So those who ate 2 slices of bacon per week compared to those who averaged 25 slices of bacon per week. Now you may say, wow, that's a ton of bacon. But, if you eat bacon every day, and no one eats 1 or 2 slices, right? If you eat 3, 4 slices a day, and that's just a part of your normal dietary practice, you could eat 20 or 25 slices in a week. Look at the huge difference. So that's the difference between the 170% that I showed you guys here. A significant difference. All right, so lifestyle changes. Of course, one of them is going to be eat less bacon if you're an African American male, right? So we want to go over 3 major areas here. And again, these lifestyle changes that I'm talking about, none of them have studies that say if you eat broccoli, you're going to have this less amount of prostate cancer. It doesn't, but it does suggest if you adopt these healthy lifestyles, in general, you will have a lower cancer risk. So the first one is to increase the amount of fruits and vegetables and limit the amount of red meat, okay, in your diet. Choose leaner meats to eat, chicken and fish. And the key is really to eat a variety of fruits and vegetables that you like. I counsel patients all the time about diet and nutrition, and a lot of times patients will ask me, well, what do I need to eat? And I ask them, well, do you like fruits and vegetables? Yes. Which ones do you like? Well, eat the ones that you tend to like, because if you don't like cauliflower, and I'm telling you need to eat cauliflower, it's unlikely that you'll do that. But if you like grapes and you like broccoli and you eat a variety of those in your normal dietary practices, it seems to have a benefit. Again, the current guidelines suggest. Okay, thank you. I'm almost.
2 minutes.
Thank you, sir. So current guidelines suggest that a person should only eat about 18 ounces of red meat per week. I wanted to put that in there, 18 ounces of red meat per week. So if you like to go out and get one of those huge steaks, you may have done yourself in for a couple of weeks there. So foods with natural cancer-fighting abilities, I wanted to put those on there. Okay, these are just ones that have antioxidant effects. You guys have probably heard that term, antioxidants. So again, there's no one on this list that's going to prevent prostate cancer. They just tend to have more antioxidant fighting capabilities. Number 2, and I'm going to move a little quickly in the interest of time. You want to increase the amount of physical activity in your lifestyle. So some of the studies suggest that if you exercise regularly, you can reduce your risk. The other thing that's important with exercise and prostate cancer is that there's several studies that suggest that if you have prostate cancer and you're physically active, you do better. You respond better to treatment, and you're less likely to die from prostate cancer if you're exercising while you're going through your cancer treatment. So it's really, really interesting. And the theory is that the body releases certain hormones that helps with your recovery. So again, when I mentioned smoking, so smoking would be a risk factor for lung cancer, as we just discussed, prostate cancer. It's the behaviors you have that increase your chance of getting cancer.
Dr. Damian, we certainly appreciate it. We have any? We have 5 minutes to answer questions from all of the various sites. We have any questions?
Doctor, with the change in what we're feeding animals today, with red meat, we're going to the sewage places, and we're putting that sewage on grass, and those animals are eating that grass, and that grass is going into the animals. Excuse me. Do you think that's having any effect on the amount of prostate cancer and other cancers that are showing up in people in South Carolina today?
Well, I mean, I guess that would be possible, but I would say that I think consumption has a big part of it. It has a lot to do with it as well. Yeah, I mean, there are probably more carcinogens that we're exposed to because of the way we prepare food and how we raise animals. But the bottom line is most of the studies suggest that if you're consuming those things, that's what really increases your risk. You see what I'm saying? So you have to make better health choices and eat healthier. I think in terms of the red meat issue is more of exposure to animal fats more than anything. So in other words, if you had a farm-raised hog that was completely healthy, but you were eating that farm-raised hog and it was bacon from that farm-raised hog, you still would be at an increased risk because of the animal fat exposure.
Yeah, Dr. Damian, could you make a few more comments about excessive weight, since we know that obesity is a major issue in the African American community, particularly among women, but it is an issue among African American men too. How does that relate to prostate cancer?
Oh yeah, I'm glad you asked that question because I wanted to bring that up. There was another study that looked at obese men and delay in diagnosis of prostate cancer, and what they found is that men who were obese and had a PSA test done, of course we're going to talk about this later on, their PSA levels were abnormally suppressed because of the obesity. And the thought is that there's some hormonal interaction that's causing those men's PSAs to be lower when you're obese. So the problem with that is that, let's say you go and you get your PSA done and you're obese and it's, quote, normal, but you still have prostate cancer that's actively developing in your body. You may have a delayed diagnosis compared to a man who is of a healthier weight. And so that's, to me, that's a critical component of obesity and prostate cancer. I just thought that was really interesting that those men that were obese had a tendency to have a delayed diagnosis because of the obesity affecting PSA levels. And we're going to talk about that later on, but it is it's a significant problem.
Are there any other questions from any of the other sites? I have one more question that I would like to ask.
I have one. I'm in Charleston, South Carolina. My question is, even though one eats only 18 ounces of red meat per week, does preparation of that meat have any significant value in reducing the risk of getting those added carcinogens?
Yes, that's a great question. Great question. I think I know where you're going with this. So growing up, I liked to grill, and we used to really burn our meat, right? And you would remember we would try to get that charcoal part of the rib and wanted that part of the rib. Well, there's a problem with that. There's more carcinogens in that meat that is burned. And so the rarer the meat, it actually has less carcinogens. And then that study also looked into food preparation. And apparently, I don't know how they figured this out, but there's some suggestion that meat that is properly marinated tends to have less carcinogens in the meat. So the bottom line is if it's rare, it tends to be, relatively speaking, healthier for you, as opposed to eating meat that's very well done or burned, and you're eating that part of the meat as well. And then food preparation matters. So, yeah, that's a great question.
Hey, we have a question in Columbia too.
We talked about the risk factors, and you mentioned a little bit about genetics. if you eat healthy, exercise, and all of those things, how great a risk is it still that you can inherit that gene?
Right. That's a very good question. So what we know is that if you have a first degree relative, that means your father or brother that has a risk of prostate cancer, that it increases your chance regardless of lifestyle changes. If you have a brother, a father, one of those, and say an uncle that has had prostate cancer as well, that your risk really goes up. So in other words, first degree relative, someone who's in your immediate household, your risk is higher. It goes even higher if you have first degree relative, someone in your family, and like the brother or an uncle. So if you got an uncle and a brother or an uncle and a dad that had prostate cancer, you really, really need to be, screened regularly for that, because your risk does go up. And that's the part we don't completely understand.
Yeah, I have one final question, Dr. Damien. I see a lot of African American men, and they get this thing about fitness and working out confused. A lot of black men feel that if they go to work every day, then they're working out. Can you make a few comments about how much working out you're supposed to do and et cetera?
Right. So the current recommendations are that you should have what's called moderate exercise, moderate intensity exercise, 30 minutes at least 4 to 5 days per week. Or high intensity is 20 minutes 4 days per week. So what Dr. Bell is hinting on is that, say you have a job, say you work at a job where you're on your feet all the time, and to you that is exercise. If you're not getting your heart rate up enough, then it's really not, although you may feel like it's exercise, it's not really giving you the health benefits. So moderate intensity exercise would be walking 3.5 miles per hour for 30 minutes. So a brisk walk, so that when you're talking, it's difficult. Maybe your speech, you can't talk as well because of the exercise is vigorous. Or say swimming. If you swam for 30 minutes, or you rode a recumbent bike for 30 minutes at a certain rate, that's all moderate exercise. Or say if you push your lawnmower, not a riding lawnmower, if you push your lawnmower for 30 minutes at a nice pace, that would be in the moderate intensity exercise. So it's not just having a physically demanding job. You need to have certain defined periods of either moderate or high intensity. So if it's more high intensity, you don't have to exercise as long. 4 to 5 days per week. I usually try to get people to start off with 3, right, and work your way up.
Well, Dr. Damien Daniels from Wellsprings Family Medicine, we certainly appreciate your presentation. Thank you very much. And we are now going to go to